చాలు జస్ట్ ఆగిపోతుంది. వేరే వాళ్ళకి పైకి పంపించేది అవసరం ఉంటే వీళ్ళని వ్యక్తిని పైకి పంపించేది పంపిస్తాం సార్. వేరే వాళ్ళే ఇక్కడ ఫిఫ్త్ ఫ్లోర్లో ఎందుకంటే మేము ఛాన్స్ తీసుకున్నాం, మళ్ళీ ఇక్కడ కాదు పైన ఇబ్బంది అవుతుంది, అందుకని పైన ఉన్నాం. ఒకసారి అది చెప్తే మేము అక్కడికి వెళ్ళిపోతాం. ఎవరైనా మనమే. Are they going to the fifth? Hello? Hello?
First of all, good afternoon, everybody. It's lovely to be here. Thanks to Pinky, but I've been hearing about this initiative, and she's been talking about it. I know she doesn't take any credit for it, but she's been talking about it, so making us aware of what is happening. And health is something, obviously, after what I've gone through, I take a lot of interest in. So I was very keen on knowing what happens. And when she said that this is what we were planning, I said, of course, you know, it's my pleasure to be here. And it's great to see you all, and a lot of pinks also. So that's great that we followed the color code. But what doctor said was absolutely right, that early detection saves lives is a slogan that we should all remember. Because what I realized is that cancer is a scary word. We feel that life has ended, everything comes to a standstill, but that's not true. If you detect cancer early, it's something that can be cured, that can be treated. And we are talking about breast cancer, and the statistics that she will give are much, I mean, I won't know those. I did not have breast cancer, but any cancer caught early, it has a much higher chance of, of curing it rather than, it being the scary word that it is. So early detection does save lives. I've been part of that brigade which says that, oh, I'm healthy, I don't need to test, I don't need to do even a blood test. I mean, we all say yearly health checkup, but how many of us procrastinate about it, and we just don't.
I'm the first one.
Yeah.
Also. And my husband's always shouting at me that, get your test done.
Yeah, exactly. And we're just like always not.
So I'm going to register myself here as well.
I want to see her do that.
Yeah.
But that's the thing, this is just going through it regularly and catching it early. It just, saves you from so much more pain, because cancer is one of those diseases which I feel that the treatments for it are so much more harsher than the disease itself. So imagine if you could catch it early, you go through minimal invasive treatment, and later on when you have to go through very harsh treatments, for the rest of your life, your body is shattered. It's gone through what it has gone through. Your nerves are gone, your veins are, it's just such a harsh treatment. So why put yourself through that? And that's why early detection is extremely important.
Thank you for that, ma'am. And I'm fairly certain a lot of us are feeling already plenty motivated, Pinky Garu to begin with. Ma'am, you just discussed the fact that it is a debilitating disease physically, but it really takes a chunk out of you mentally as well, doesn't it? Mentally also, it really takes something out of you. I would like for you to kind of share a little about how was it to kind of, the will and the determination that mentally I've got to do this.
Well, my son was very young, so that was my will and determination. I needed to survive for him was the thought in my head. I think most of us are, and actually, especially when I go to the hospitals, like when you go to Tata Hospital and all of, various places in our country, when you go to the smaller hospitals, and you will never call me a warrior again. You will never say I'm strong again. If you see the women and how they deal with it, I've had a great support system. I'm blessed. I had everything that could be given. I mean, there are women who are pregnant, who are dealing with young children, who are dealing with families who are refusing to accept them back and think that it is their fault. I mean, when you see what they are going through and the treatment that they're going through and coming out of it, that is an eye-opener for me. And, it just makes you understand. You realize how blessed you are. So I would say that whenever you go through something physically, of course, it takes a mental toll. And when you look at how fortunate you are, you look at the positive side of it, when you start to look for it, then suddenly the glass is half full rather than half empty. And I know these sound like cliches, but literally small things like that is what take you through. So through my treatment, there were 2 hashtags that I had formed. One was one day at a time and switch on the sunshine. And one day at a time that's what it was. Because, the moment you look at, oh my God, I don't know when the treatment is going to, it overwhelms you. So for me, it was like, let me get through today and I'll deal with tomorrow. Which helped me kind of live in the present, which is what our culture teaches us, which is what everybody and our parents have always told us, that live in the present. Easy to say, difficult to do, but that did help me do that. And switch on the sunshine. It's like switch it on. Every time you think something is pulling it down, you say, I'm going to switch it on. And look at the positive side of it and, kind of start thinking of it from that angle. And that's how it is. And then mind is definitely something, it can make your body do amazing things. And if you can get your mind to work with you in healing, then your body will heal. It will take to the treatment much better.
Beautiful. So lovely. Can we have a little bit of an applause for that, I think?
I remember her when I went to visit her a couple of times in New York.
Yeah.
How many months were you in New York?
I was there
For 1 year? 2 years?
My first one was a 6-month chunk, and then 3 months.
Yeah.
And how old was your little boy?
When my son at that point was 12 when I was diagnosed, and then obviously he was 13-year-old through my treatment, and yeah.
Ma'am is already committed to getting regular screenings done, but would you like to add on to this point? Do you really believe that, the importance of a woman in a household or in a workplace is just tremendous, and everything around her flourishes because of her?
Absolutely. For example, we've seen in generations, my grandmother was like the center point of the whole family. My mother is, I guess even I am. I think every woman in their home is the most important. So since I'm saying this, I promise I'll come back from my next trip and I will get my test.
Literally, that's the only reason
I like
why
the way she has said after my next trip. She's already postponed it.
No, but the reason why I asked, ma'am,
No, but it's a fact. You are absolutely spot on. I mean, I think each one of us know our families know how important we are. And it's very important that if not for us, I think if a woman collapses, the whole household collapses. Even if they don't want to accept it, the guys don't accept it, but it's a fact. The kids want the mother, the husband wants the mother, the whole family wants even whether to fight or to love or to whatever. We're there.
I see
or the punch bag.
To fight or to love.
Yeah.
And I see the men cheekily smiling also.
Come.
No, okay, so I'm actually grateful.
Come in the front. Come. Yeah.
I'm grateful that you mentioned this. Like I said, the reason why I was so keen on highlighting this is that we forget, but we really mustn't. So please go get yourself screened on time, okay? But now that
somewhere women have the conditioning also that, somewhere even however educated we are and everything, it's the male in the house who's the bread earning kind of a thought process is that and has to be looked after. and
We
has to be
women
fine.
keep ourselves in the back.
Yeah.
We
And
like
so
look after
everything
everybody, but we forget about ourselves. And which is very
Somebody
important, I
else
think.
needs to remember about the women. So all the men here, please go back and take care of the women in your family. Remind them that they should go for the checkup. It's your jobs now because they are doing some other jobs for you.
Yes.
Ma'am, since we did speak about families, and if you're comfortable sharing this, you know, what the person is going through is difficult, but to see your loved one go through this also is something else altogether. How was it for your family to cope, ma'am? And I know, you know, Ranveer was very little.
No, I think I've always said that I struggled. Everybody does. Like we spoke about the mental health, and I took help for it. And you know, at one point, you know that sometimes you can't break through. How much ever you might say hashtag this and hashtag that, it's great, but there are times when you need the help, and you need to understand that you know what, it's going to an area where I need the help, and then you reach out and take professional help. And in the same way, I would say the primary caregivers or the support system need help, and they need a support group. And so, I mean, if your facility also can organize it and all that, if you can have support groups, because what a primary caregiver goes through, only they know, because, you know, the patient gets the attention. But the person who's looking after the patient is also struggling and is going through so much. They're seeing their loved one go through it. And, you know, also there are times when you're in pain and you know, they feel helpless. So there's so much that they're going through. And a support group really, really helps. So these are the groups that help you deal with it. Sometimes there are, you know, small things that maybe nothing, I mean, doctors help. But there are certain small things that just caregivers can help you with, because doctors come and give you the medication and all of that, but somebody who's looking after them every day, they have certain tips that really make a difference, you know, and it can be the side effects of the medication that how to deal with it. Like, you know, when you go through the chemotherapy that I was going through, from your gums to your mouth, everything is bleeding, because all soft tissues are just bleeding. And now if your gums and your teeth are bleeding and you have to eat, you know, that's just it's an open pore for infection. And sounds gross, but that's what it is. But just a tip from a support group or a caregiver which says that, listen, without fail every night, gargle with baking soda. As simple as that. And I never got an infection in my mouth, and it was just that done. So things like this, which are not very big, but make a big difference. And that's where the support group, the mental health, all of that comes in to help you. Because see, the moment there's an infection, it's going to set you back from recovery. Because, so the idea is to not let any infection take over while your treatment is going on. So your body can only focus on what it needs to focus on. And this is where all these other things help you with.
Thank you. Thank you. It takes a lot of courage to kind of really share all of this. And I'm sure everybody over here, no, not gross at all, my God.
Not gross, but I must tell you one thing. I've seen in my experience of a lot of my friends who've had cancer, who have got it in the first stage or second stage, and they're doing fabulous now. Yeah. And I think they've never looked better. This friend of mine, Reena Dakar from Delhi, she says, I've never felt so much better, looked so much better, because earlier she would eat wrong, drink wrong, live wrong, everything wrong. Now with this, after her cancer, her life has changed. And she's become so, you know, with it, and so focused with her exercise, diet, food, everything, and checking herself. So I think it really helps. A couple of my friends in Bombay too. So I just feel, in the bad, there's something good which came out.
You know, Pinky, what you said is so true, because we all say that, you know, like you said, it is very easy if you've been, there has been excesses in your life, they're easy to identify. But like in my case, there were no excesses. So it was like, what am I supposed to change? Everything is healthy, so what is it that I'm supposed to change? So then to understand where it comes from, and every time, now there are obviously environmental things, stress-related things, and genetics, very, very important. And what happens is that none of us want to share our genetics and admit to it that it's there, because it's such a taboo thing that, oh, it's in this family. It becomes this big thing. But the fact is, you're trying to hide it and say that, oh, our family is perfect and we don't have something like this in our genes. But what happens is that the moment you know and you test, if you genetically test it, especially with breast cancer, you know what to expect. You know that you need to look for it. You catch it so much even before it actually happens.
In
Because,
fact,
you know, there are new tests now which you can actually, you know, pre-cancerous stages now. Not even, even before it turns cancerous. So if you have this kind of information, that's your weapon. It's in your arsenal. Why would you waste it and not take care of it? So genetics is also very, very important. And for me, I would say that, like we talk about healthy food and all of that. See, everything, there has to be a certain amount of healthy, but everything just healthy is not for everyone. I'm sure that your friend, there's a nutritionist who does healthy food, will tell you that, you know, for everybody, it's a little different. So what can be great and healthy for you might not be the great thing. Like everybody says, for example, small example, they'll say flax seeds, flax seeds, flax seeds. Great, they're very healthy. But if you have estrogen-related cancer, flax seeds is something you should not be having too much of. So you need to understand, and it needs to be personalized. Everybody is different. And so in that same, like how her friend made a certain change, for me the change was to identify what suits my body, what suits my gut, you know, and understanding and getting in tune with my own body.
Wonderful. Thank you for that. In fact, I was going to ask another question about it, but now that you already mentioned it.
Yes, Ms. Sonali answered my question, I guess.
So we were
about the diet. And you
such an
answered it better
overachieving
than
lot,
I would
must
have.
say. No, certainly. In fact, we were going to wrap up the conversation with a cute little segment I was feeling very clever about, called Satya Ya Mithya. So I was going to pose share a few statements with Dr. Sneha, and she was going to confirm if it's the truth or if it's actually a falsehood. She will. So
Is it just true or false, or do you want an explanation after that?
You can. I don't know. Do we have the time for explanation? What does the audience want? Brief. Done. All right. So we've already established. Okay, let me begin with. Breast cancer happens only to women.
Mithya, is that false?
That is false.
Yes, it's mithya. I think by now a lot of us must be knowing that even men have breast tissue, though very rare. It accounts, suppose there are 100 breast cancers, maybe one of them could be a male. And there are certain risk factors. If there is a male breast cancer by any chance in your family, it could be BRCA related. A gene called BRCA is being talked about now, and male breast cancers are very commonly BRCA related. So having a breast cancer male relative in the family indicates that the close relative should get tested for BRCA. And it's more common in the African American race than the Asian race. And unfortunately, it's more aggressive than what it is in women.
Right. Thank you for that. All right. The second statement, breast cancer is only a very genetic condition.
So this term genetic, every cancer is a genetic disorder. So cancer happens when there is a gene disruption. Being genetic is different from being hereditary. Hereditary means carrying a culprit gene which is being transmitted from one line of a generation to the other. So you meant, is every breast cancer hereditary? Yes. So only 5 to 10% of breast cancers are hereditary. 95% are sporadic. That means it can happen to anybody.
Right.
That's so true. Because when people say, oh, it's not in their family, how come she has cancer?
Yes, but 95% don't have a family history.
Yeah, that's right.
Yes.
We always was told that it's only in the family.
Right.
But a lot of times families hide it, you know, they don't tell. They say, they call it something else and they don't talk about it, they hide it. That's what I realized, that nobody talks about it. And that's why having the conversation about it and saying that it's not such a, it's not a taboo subject was so important.
Yes. In fact, one of the reasons why we're here, ma'am, and I'm glad that you highlighted that, is
The taboo.
it is not a taboo. Your body is going through so much. You are fighting every single day. Where is the shame in that? We make productions about talking about, oh, I'm down with the fever. Oh, my God, my nose is blocked. Why? Why are we hiding this if it's going to save your life?
Shazi, before your next question, because you brought up the topic of taboo, I would like to deeply thank Ms. Sonali Bendre for mustering the mental energy, the physical energy through her journey to put forth her journey out there to public and to break the taboo, right? And what she did to cancer in recent times was, according to me, what Diana did to HIV when I was small. So I would sit there and watch Nat Geo with Princess Diana, hugging HIV patients. And now, when Sonali posted her story on Instagram, and I showed it to many of my patients, Sonali, who would sit there distraught at the time of their diagnosis, weeping. And I also had a patient who was threatening her husband that she would commit suicide if she loses her hair. And your post would just wipe their tears. They would sit there quiet when they saw your picture on Instagram, and they would find this newfound courage from, I don't know where, from your post, and they would walk out courageously, complete their treatment, and come back smiling. So what 15 to 20 minutes of my counseling couldn't do, your stories has done to them. So that's how much Sonali's story has impacted the social stigma about cancer. And as a doctor, it's my plea to the society, if anybody is diagnosed with this disease, do not give them sympathy, just go give them strength. Sympathy bogs them down. You might be empathetic in saying, oh, you're looking so tired, but that's what puts them down. You have to give them positive energy and not sympathy to drive the treatment ahead.
Thank you, doctor. Thank you so much for that.
Sonali, can I ask you, can you share something with all my friends, something which you've never told anybody else, something which was this in your heart, you're like, oh, I can't say this, but some experience, something which you like, gosh.
I've spoken so much about this journey, and I promised myself that I'll be very truthful about it as much as I can be, because I really feel grateful. I feel I got so much love from everybody. And when you mentioned, what you mentioned was that when I put that post out, and it was just to inform that this is happening and I don't want gossip around it, and I thought that would be it. But the response that we got, and I realized that it was prevalent in all parts of the country, world, all stratas of the society, all genders, everything. So I was like, why, if it is so prevalent, why is nobody talking about it? Why did I feel, and you know how I felt that, oh, I'm so exposed, I know so much, I've traveled so much, I read so much, that, I should know. And I'm like, I was such a fool, I didn't know anything about this. And it is so prevalent. And that's when people reached out and they started talking about it. And the stories were all of how they were hiding it, be it from their parents, spouse, child, they were hiding it.
Some people do that.
And I just
And that adds to the stress. That adds to the stress, because fighting together is much easier than fighting alone.
Because for me, my support system came with me, like we said, when Pinky came and met me or whatever, all my friends would come. Yeah. We had such a good time, actually, because it was like, I don't know how much time I have. And the kind of clarity you have at that time, I said, I'm going to make the most of it. Now imagine, thank God I made it. What if I didn't? And I had spent those last few months in a dark room hiding from people? That would be so sad. So I was like, this is not what I want. And I'm like, why are we not talking about it? And then I realized that, okay, what is it that I bring today to the table with the, I hate the word, but everybody talks about the celebrity kind of whatever, the culture that they talk about. So fine, okay, if that is what it is, what I bring to the table is what they call the celebrityness of it, then what I can bring is a conversation. Let's start the conversation. So that's what I thought I could do best. Like Pinky is doing what she can do by creating, her family is created this place and giving it back. I felt that what I could do was talk about it, start the conversation, and get people talking about it. That was my way of giving back.
Yes, I think you and your friends have shown the world how a cancer journey should ideally be taken, one day at a time, because we as doctors cannot predict, and you as a patient, every day is a new day, every symptom is a new symptom that can't be predicted. So one day at a time is how it should be.
Thank you, doctor. You're fabulous, thank you. I don't think the oncologists get appreciated enough, and I mean, sadly in our country.
God, we do. We appreciate them a lot.
No, I'm just happy to be with the three most impactful ladies.
Thank you. I'm deeply, desperately pressed to continue this conversation, but I know ma'am has a flight to catch. So before we wrap up things, I would like very much to, invite Dr. Lakshmi to come up and talk a little bit about. Right. Yes. And just talk to us about the ladies. There's a lot of screening that happens over here. Just hint. She's going to talk to you about that.
happy, I think very eventful, very inspiring and very motivating evening I feel for all of us. Is it not? It was really motivating. And as we all know and now we all agree that screening at right time and early diagnosis, taking treatment and also checking a lot of things, monitoring factors during our treatments and also checking out the prognostic indicators and all that during the treatment part and all that are very crucial for any disease, but especially for cancers. So in general, I can say I'm very glad and very happy to inform you all that all this can be done at our GVK Health Hub, at our lab services and at our radiology departments. Everything can be done at our place. I think now we are all aware and the facility is for you and it's all our choice to just go ahead and as Pinky Madam promised that she's going to have her health checkup, I think we should all take a vote that, you know, we are aware, but we have to use the facilities and we have to use the opportunities and go ahead, take a vote that, yes, we get screened at early
After
stages.
my next trip.
Yeah.
Shilpa, can I request you to introduce, we have a young artist.
Yeah, we have a young artist among us. His art is with threads and nails. And he also presented a portrait for Pinky, and today he would like to present Sonali with one of his art pieces. And he threads. And his few pieces are also displayed on 5th floor. And if you guys are interested, you can take a look at them. And all that he's going to sell today, the entire proceedings are going to go for cancer survivors. And they're very well priced. So you can.
I request each one of you all to come upstairs to the 5th floor and have some coffee. Padmaja, you'll enjoy the coffee. Yeah. Just see, that's all made of thread.
The more you see it from a distance, if you see it from a distance, it makes.
Oh, wow. It's not a picture, the back. It's Balaji.
It's just, yeah.
If I give you a picture, we have time, you could make your face. No, I don't want my face. It's stunning.
It is very beautiful.
It's beautiful.
Ma'am, here, please.
Before we wrap up our conversation today and partake in the deliciousness of the high tea that's organized for you all on the 5th floor, if you all have any questions for our amazing panelists, now is the time to ask. I'm going to request a few people to help us with mics. If you all have any questions, and if you... Yes.
I'd like to thank Mrs. Pinky Reddy. There's no better person to host Pinktober. You wear the pink in your name. Thank you so much for this. It's really important. Two things that I would like to say. You all must be aware of Mr. Nori Dattatreya, a very eminent oncologist, the first in the country who is at New York now. And he said in one of his interviews to listen to the whisper. The body only whispers before it screams out aloud, and don't miss that whisper. Sometimes it's important for us to search for the whisper also. Number two, we are the privileged sector of the society, and we have access to information, we have access to mammograms, but the larger working force in our houses and offices are the ones who need the help. If you can, educate them about routine screenings, send them for screenings, and if possible, sponsor their screenings. That's my little request to you all today. Thank you.
Thank you everybody. We have high tea arranged on the 5th floor. I request everybody to step up, please. Thank you.